I'm Haven.
I'm Daicia, and we know our rights.
I totally forgot. I'm so sorry.
Do you need to take my glasses off?
No, you look great with them. I like it. It's your style.
I'm Haven Essien.
And I'm Dr. Daicia Price.
And we presented the mental health portion today.
We wanted people to understand that mental health is a continuum. So many times young people and older people think of, as soon as we say mental health, they think of mental illnesses. And we wanted to demystify some of those things to reduce the stigma, to just actually say our mental health, they can be on a continuum from healthy all the way to illness and all these things in between. So we wanted to make sure that that was highlighted for people and to know what to do when you're at each stage of the continuum. Haven brings in this what happens in our bodies and things like that. But we want people to understand that our mental health is a range of emotions, and that's typical because sometimes they think, oh, I should just be happy all the time. And that's just not real life. And actually, if someone is happy all the time, that will be a concern. If someone's sad all the time, that would be a concern. So we don't want it to just be just one way, and to help them to understand that those emotions and those feelings, especially during adolescence, is typical and actually a part of typical development, to hopefully help them to be able to share with others when they're experiencing different things, and to know the difference from if this is how I should be or if there's something I should be concerned about.
And there are multiple things can be true at once. I think we also stress that a lot, is that you can be happy and sad at the same time. You can have a lot of joy or feel bittersweet or have a lot of different emotions at once regarding even one event. So it's allowing for that spectrum and also being really intersectional in how we're feeling. I think for me, it's kind of taking what we had talked about, and we talked about a couple of different things, but even just as simple as a body scan, being really aware of what's going on in our body, why do we have that, are we feeling tense? Why do we have that tension? Am I thinking about something that's stressing me out right now? Kind of taking that second to just be aware and kind of reflect and see, am I in a space where I'm healthy, injured, ill, or reacting in a certain type of way, which is kind of really hard for a lot of the youth because there's not a lot of time in the day to do a lot of things as an adult, let alone a teenager. You've got school, you want to sleep, you've got all this homework and things like that. So I think it's also recognizing what they can do with what we've given realistically. And it's just kind of asking them to try to be aware of that.
So I would say in Detroit specifically, especially during COVID, we were able to see the disparities and it was just very clear. One of the biggest things that we've seen is just the limited access for behavioral health services for people based on their income or even based on where they live. So many of our communities have a shortage of healthcare professionals, and that includes mental health professionals. So we're seeing that people are not able to get the access that they need as soon as they need it. We've also seen a workforce shortage in our crisis responses. And I do think another piece of the disparities that we're seeing is that in communities where we're seeing suicide is a huge issue for young people between the ages of 12 and 24. And while we have seen some communities have a decrease over the last 2 years, we've seen an increase in Black boys and girls by 5%. And so when we think about that as a disparity, it's okay, what is happening here is decreasing in some communities but increasing in others. What are the reasons for that? So I think that's important to note too when we talk about how critical it is to have access.
I am a biracial Black woman with a Nigerian father. So there are a lot of different intersectional things at play as well, and I went to schools that were predominantly white as well, and I was the only person there. And also, as somebody who is in a lot of spaces and wants to go into specifically the healthcare field, I would like to go to medical school to be a physician. I found it to be really, really, really important to listen to the community, speak to the community, and also understand how can I be present and represent our community in conversations where we aren't being present.
The things that inspire me to make change for Black and brown young people in particular is my son is someone who is currently incarcerated, and a lot of that was due to him not knowing his rights, and actually us not knowing our rights either. And as a social worker who wants to move forward with a socially just world, I think it's very important that I provide my time, my talents, my energy to efforts that are already in place that are doing such an amazing thing for young people.
I'm Haven.
And I'm Dr. Daicia Price, and we know our rights.